Good afternoon, everyone, and welcome to today's webinar on healthcare social media taking the leap. My name is Benjamin Max. I'm the Manager of Communications and Member Services for the New York Chapter ACP. Our speaker today is Viren Kaul, MD. He is a Chief Fellow of Pulmonary and Critical Care Medicine at Mount Sinai School of Medicine and Elmhurst Hospital Center. He's also the social media editor of Journal Chest and the social media subcommittee chair, ATS section on MedEd. For NYACP, he is both a member, he's on the member engagement committee and is the council board rep for the Brooklyn, Queens, Staten Island region. You can follow him on Twitter at Viren Kaul. Before we begin, I would like to review a couple of guidelines. All participants will be on mute since we have such a large audience. If you have a question, please type it in the dialog box on the right, and Viren will answer all the questions as they come in, either at the end or when they're relevant. If we run over the allotted time, we will send answers to your questions via email. Following the webinar, you will receive an email with the handouts from the presentation. Also, there will be a recorded version of today's webinar posted shortly on our recorded webinars page. But now I'd like to welcome Dr. Viren Kaul.
Thanks, Ben. And hello, everybody. Thanks for joining us. I know some of you guys must be off today for Veterans Day. So thank you for taking time out from your day. So we'll get started. And the biggest reason we thought this is relevant from NYACP standpoint is because as leaders in the medical education space, especially in internal medicine in the state, we feel this is a topic that's pertinent in terms of medical education, in terms of facilitating growth of organizations as well as physicians in general, even if you're not in academic space. So we'll do this in two parts. The first part today is taking the leap. So basically getting started, understanding what social media is, because clearly it's little more than just Facebook or Instagram or Twitter. Interestingly, what we're doing right now, running a webinar where we can all interact and learn from each other, counts as social media. So I'll get right into it then. So Ben already did this, but if you need to reach out to me, you can email me or you can reach out to me on Twitter. What I wanted to talk about most importantly today is that I think a lot of people who want to get into this space are a little worried about what this entails. There's a lot of press about the pitfalls and issues of social media. And I just want to say that it's better to just understand what this whole space is about instead of fearing it. And I hope that I'm able to achieve that today with you guys. So we'll go through what social media is, why is it important to you guys as physicians, as clinicians, and what are the different platforms, different areas and spaces you can engage in with your audiences or learners or colleagues. And then the pitfalls of social media, what you should be thinking about, what you should be worried about, or what you should just look out for in general. And we'll do a brief introduction to Twitter, and I'll go over why I picked Twitter as a platform to discuss today. Of course, after this presentation, if anybody wants to talk about other platforms, I'm more than happy to do that. So going over social media, so the dictionary defines it pretty much, and I think this is important. I just didn't put it here because I wanted a educational slide. The reason I put it in there is because it's all forms of electronic communication, which users can employ to create online communities, to share information, to share ideas, messages, collaborate. And as such, it is a little more than just the common platforms. And that's important to remember because we forget that whether we like it or not, it's all around us now. So the way I see it, this is my understanding. This is my area of research. I do mostly sociometric research in MedEd now. And the way I see social media is basically there's the provider. I'm having some trouble with, okay. So you have the provider up here, whether it's a doctor, a nurse, or any other type of healthcare provider. You have a group of providers. So you have your colleagues, within the state, across the nation, and internationally. You have the patients. the patient's families, their caregivers, and then in between all of this, you have different modalities that connect them all. And the reason I think this slide is important is because we have to remember that this is not just about us. There's no way to control who else is on social media. So the patient that we saw in clinic today, or the patient we're taking care of in the hospital today, their families might be on there looking for information, looking for support, and it's important to be cognizant of that. And as far as I'm concerned, I see it as an opportunity, because it is an opportunity to connect with the people we treat. And I'll go over how we can do that effectively. So why is it important to you? I think this is the meat of the presentation. I think everybody wants to know why social media, and I think the easiest way to put it is that it's literally all around us. We have two big opportunities here. One is to improve communication overall in the field and outside it, and then the other thing is that it's an easy vehicle to reach anywhere in an instant, right? You don't have to fly anywhere. You don't have to, like, I'm sitting right now talking to everybody in their own offices or homes, and the hyper connectivity makes it sort of, it behooves us as physicians and caretakers to sort of take control of the space. Um, so these are some statistics that I've always found very impressive. These are the 2017 trends from the Pew Research Center, and what we've learned is that 89% American adults are using internet, and then 69, which is 70%, are using social media. So they're everywhere. They're looking for information everywhere. And what makes this even more sort of impactful is the fact that about 80%, 77% people are doing this on their smartphones. So there's the portability aspect. There's the versatile nature of how they can access this information. So this slide I built basically to sort of communicate everything that you can and could and should do on social media. So we'll start from the easiest and the most obvious, which is the personal presence and impact. So you can Google yourself and you'll see that you're already out there. Your practice is out there, your NPI numbers are out there, and your patients are looking at you. So my patient last week actually walked into clinic and basically quoted my own study in sepsis to me and said, well, you know, you took care of me when I was in the ICU, and so what do you think could be done differently? Or what do you think you guys missed something in my case, because you seem to have looked at it up? And that was interesting to me because I think it led to a lot of interesting conversations. It's really helpful to have patients who are that invested in their care, so you can actually build your presence ahead of time, and your patients can learn from that. At an organization level, if you guys are administrators who are listening and attending, I'll go over this in a second, but it's an immense opportunity to learn from our patients. They will just tell you. We don't need Press Ganey surveys. We don't need to send out surveys. They'll just tell you what they think, and it's easy to pick that up and sort of put it into effect for change. Talking about learning, this for me is where this is how I got into social media. So you could be just about to go to sleep, and you want to just go on Facebook for half an hour, and there's so much data out there, so much information that's being shared by societies, by journals, by your friends and colleagues, that it's learning in an instant, right? In an instant. So you basically don't have to go and sit and look for journal articles. You don't have to go to the library to know what's the latest out there. This for me is the biggest. This is helpful for everybody, irrespective of what your overall goals of engaging with social media are. Finding mentors and sponsors is huge. Social media is basically flattened hierarchy completely. It allows you to just basically collaborate irrespective of where you are. All you need is your computer and the ability and the willingness to sort of reach out to people and find common ground. What I also use it a lot for is receiving feedback, and I'll go into it. You can improve the content of what you're doing. You can get ideas for things you want to engage in. Lastly is the advocacy and the wellness aspect. I'm sure all of you are very aware about, and this is in the spirit of staying completely apolitical, you've heard about the recent campaign going on in the last 2 or 3 days, 4 days about gun control and how doctors are stepping up and trying to do the right thing by talking about how they've seen it impact their patients' lives, and that's taken a whole life of its own. And a lot of organizations are using social media, including NYCP, to affect change for your patients at the advocacy level. And it lets you join that without having to say go to the Capitol Hill. Everybody can do that with time restrictions. And for what I find most interesting, lastly, is the social media-based research. So sociometric research, medicine is not being shared in classrooms anymore. I recently was told by one of my students that 20% is the current attendance rate for first years in med school, which is a little scary for me. But they'll go and learn on social media. So we'll talk about that, and you can use that to understand how to deliver better medical education, and that's the research I do. You can also work with general journals. You can work with organizations for knowledge translation, for curation. So, for example, my work with NYCP is to figure out how to make all the members more aware of what the organization does and to reach out to you all better. And we use sort of ongoing research on engagement to affect that. So talking about personal presence and impact, this is, just to keep this sort of fair, I looked myself up. And as you'll notice, in about less than 1 second, there's 60,000 results. I assure you they're not all about me. I'm pretty sure about that part. But the fact is that there's so much information about me on there that this went on for pages. And there was a blog that I started when I was back in India doing my med school about food, and you can find that now. And as scary as that is, it's interesting how all of this gets cached. So what I would say is that I think a good way to start on social media is to sort of Google yourself. Just put in your name, put it in different combinations with MD, without MD, or DO, or what have you, and put in the name of your organization, look up what shows up. And then that'll at least give you an idea about what your digital footprint is and what you want to work on to improve. Of course, it's difficult to do everything in one go, but this is a good sort of starting point at a personal level. In the future, as you start working in this space, you can actually build a profile, a personal presence, so your patients know ahead of time who you are, what you're about, and that kind of helps build expectations. And I find it pretty particularly effective for that. So my Twitter or my sort of official accounts with Doximity are on my business card now, and we send it out to our patients ahead of time. And if they have any questions about who I am or my clinical beliefs, they know ahead of time. So I'll tell you why being involved with or understanding and evaluating social media presence and activities is important at an organizational level. So this is one of about hundreds at this point. Publications that basically, so this particular publication basically talked about how almost every US based hospital is at least on one platform or the other. Of course, the university hospitals or teaching hospitals tend to be on multiple platforms. But this article in particular talks about how different hospitals are using social media for their purposes. So whether it is to tell patients about their services, to talk about their research, to talk about how they deliver effective care. And interestingly, this translates into, or there's an association, for example, in this study, it showed that a hospital's 30-day unplanned readmission rates, right? They correlate with their Facebook rankings. Now, of course, one's not related to the other directly. I think that would be a little foolhardy in terms of causation, right, to assume. But the inference of these studies is that your hospital's performance is people are giving you feedback, and it's almost there in real time. And you can use that feedback to improve. So if there's feedback about your ER, about wait times, about staff attitudes, it's right there for us to use. And And this is a big change from back in the day when you would have to send out letters and surveys, and then people would respond, and maybe they didn't. So I think there's a huge opportunity for organizations to take this and improve how they are. I know that some organizations like Mayo and Cleveland have taken this to a huge another level where they have videos and interactive posts and as you know right now most patients can actually access their EMR records via the organization as well. So they have that then support for these patients to access off of the organization website. So this is a huge area of growth and to affect actual patient level impact. Talking about education, I know a lot of you guys are in academics and you want to know about why social media is helpful. So this is just 4 or 5 sort of representative blogs. So if you're not somebody who wants to spend time on social media, putting in too much effort into interacting and so on and so forth, what you can do is use resources like these blogs or these podcasts, um, and just absorb information. And it's a good starting point to figure out what's the latest. So most journals, like you can see here, Annals of Internal Medicine by ACP, American Thoracic Society, CHEST, because that's the area I work in. And then sometimes independent podcasts like Core IM, which is out of NYU. Um, they're great places to start. You follow them. They're quick reads or quick listens. So blogs, for example, Clinical Correlations correlates with it's a sister as a content source to Core IM. If you read, for example, something off Clinical Correlations and follow it up with Core IM, if it doesn't actually answer a question for you, at least it'll give you an idea about what you want to look into. So I find these very effective for all levels of or anybody in any setting who's willing to sort of move to the next level. Talking about finding mentors and sponsors, like I said, this has been one of the most sort of rewarding parts of what I do with social media and medical education. For example, I have a tweet here by Ankita, who's one of the NYCP leaders, and you can interact with organizational, national leaders and sort of build networks where you can find mentors and sponsors. This graph on the left here, I know it looks like a lot of dots, but what it is sort of interactions at the American Thoracic Society meeting in 2018. And you'll have to take my word for it. I can always share this, but when you zoom in, most of these purple dots tend to be journals. The green dots tend to be the main sort of mentors or people who've got social media presence. And then you can see a fair amount of pink and light blue dots, which is basically almost users who are interacting with these people. And you can find mentors in a jiffy. Nobody cares what institution you're at, what your interests have been, what you've done so far. Everybody will be happy to sort of at least give you a chance to hear you out. So I think that is one of the biggest opportunities on social media, as far as I'm concerned. Taking that mentorship and turning into collaboration is, in my opinion, so much easier on social media. So for example, this publication that came out earlier this year, it literally happened out of a chat that started on Twitter, and we started talking about how to put together a resource for the critical care medicine community on how to engage with social media. And Sapna and Sean, my co-authors in the study, they were on that conversation, and Sapna emailed me and said, "Do you want to write this review?" Which I wanted to. What was the beauty of this was that I still haven't met both of them. I've interacted with them a lot. Sapna, since writing this review and in the process, has since then basically grown to be a mentor for me, um, and so has Sean. But the beauty is this is 3 authors in 2 different hospitals, and we are basically in 4 separate specialties, and yet we were able to put together something and publish it. And this is amazing for somebody who's early in their career. Sapna is literally an internationally sought out mentor who I was just able to sort of get introduced to thanks to Twitter. So that's the big advantage in terms of turning your mentorships into collaborations. Similarly, this is another example. This, as you'll notice, the last author, Sanjay, he's a very well-known pathologist, pulmonary pathologist across the country. And then along with Erica, Lara, and all these authors, these pathologists have been sort of interacting over Twitter on pathology from endobronchial ultrasound samples, and they have made this into a study. And I actually found out today morning that they've also had a couple more abstracts accepted from this collaborative study that is purely envisioned, started, and implemented on Twitter. So there is a lot that you can actually do, as funny as it sounds. And these are some serious high level researchers doing this, so you don't have to take my word necessarily for it. Talking about pure education, so if you're somebody who's just looking to improve their scope as an educator, I think social media has changed the game for all of us, simply because you no longer have to go to a classroom and teach a restricted number of people or a restricted type of learner. I think the opportunities really truly are endless. So if you're a writer, you can do blogs, which I do a lot. You can do editorials, and once you start kind of gaining your own space there, you can do investigative pieces that essentially, um, and I'll get into this, but they are being treated as full-on scholarships. So I know Mayo Clinic and a lot of bigger universities are actually including social media scholarship based on these activities into their advancement sort of criteria. And I'm sure it's effective for non-academic advancement as well. In the audiovisual realm, this is a little more difficult for standalone educators, but you can do podcasts, you can do simulation based curriculums, and augmented and virtual reality. This tends to be a little more data, not data, but a little more sort of resource intense. But if you're working with a large group that's interested in this is a huge space to get into. um, Doing journal club related activities, so this has been a very, very innovative space. So journals, organizations, and leaders have essentially started doing full blown, timely journal clubs where you'll not only have the researchers or authorities in that field join in, but you'll actually have authors join in. I did a journal club recently on a COPD study for chest, and it was funny because I'd reached out to the authors ahead of time, and I didn't get heard back, but the day of the first and last authors, they joined Twitter, and they were there to answer questions and explain their methods and talk about what the shortcomings were, so much better than I could have as a moderator. And it's the best kind of learning, right? So you're looking at data and you can critique it directly with the person who collected it. I mean, that is as firsthand as medical education gets. Of course, eventually, you can, as you evolve, and if this is what interests you, you can actually do research in this field. So, for example, our most recent, and I can't go into the data because it's embargoed, but we were looking at the presence of training programs in pulmonary and critical care on social media, and what is it that makes them tick, right? So are they even on there? Which kind of platform they're using? And what are they posting about? Are they posting about their fellows? Are they actually doing teaching? Are they doing clinical content? And we've got some very interesting results that are they're going to be out at a recent at a conference that's coming up. So I think that's the most evolved sort of engagement out of social media that you can get. If anybody's interested in doing research on that, please feel free to reach out. So talking about getting feedback in crowdsourcing content. So I do this all the time. I feel like it's become a bad habit now. So every time I'm out to do a talk, including this one, I've built enough sort of collaborations now and sort of a group where I'll just ask them, hey, I'm going to be doing this talk. What do you think? So, for example, I was doing this talk about ARDS, and but it was for the ED residents, not for medicine or palm credit. And it was an interesting thought for me. So I sort of asked this question, and it was amazing that the people who responded, for example, Dr. Gajic, he's the one who has talked about avoiding or how to prevent ARDS. He is the world leading authority. I had never interacted with him before that, and he happened to respond, and then his response spewed further interaction by Dr. Gallo, who's not only his coworker, but she's now a close friend since then. Nick Johnson, again, these are all people who are authorities, and it's funny because, as you can see from Nick's post, he says, "Hey, you should, put in this data from Gadget and Brian's work," and guess what? I got first-hand feedback. So fantastic stuff in terms of getting feedback and how to build better content, be a better speaker, be a better educator. Um, Continuing on to focus on the research element of this, a couple of interesting things. Some of these social media or sociometric affiliated researchers do not need you to file an IRB simply because this data is in the public domain, at least most of it. So that actually can sometimes be helpful because you can be very, very productive. But what I want to show you is that this is not just a fluff space. This is not a CV builder. This is an actual legit space for building yourself out as a medical educator, at least. Maybe I'm biased because this is what I've made into my sort of work now. But I want to show you this, that since 2018, this is pure output, research output. You have 44,000 results purely on social media and medicine. I'm sure a lot of this is going to be irrelevant data, but you can tell that this is an up and coming space to grow into. So talking about how else social media can be effective. So there's a couple of things. Is the advocacy and the burnout element of it, which I find very, very rewarding sometimes. So I think this is last year, end of last year, I think between being on ICUs consistently and constantly as a second year fellow, and then I think it was the winter, I'm sure it's the flu and everything, but it was basically, it was a it was a perfect storm, and I had an awful time in the ICU, and I think I just went on this sort of a rant, and I think it was just amazing the amount of outpouring of support that came out of that. I promise you there was more comments than just that one, but it just made me realize that it's not just me; it happens to everybody. And at the end of the support and the community sort of help that I got at that time, when I was not feeling at my best, was knowing that at least reaching out can be very, very helpful. So if this is something you're interested in, combating burnout and improving wellness, I think there is no better or more effective space to be except on any social media network, pretty much. Talking about advocacy, I think I really appreciate this element of what New York ACP does and other organizations do. You as a physician, I think us as physicians, we have responsibility of sort of being there for our patients, even when it seems like there are actions and ideas coming out that might not be in their best interest, and sort of going to bat for them. And if that is something that interests you, it does interest me. You can work with these organizations, especially NYACP, for example, if you're a New York-based internist, or any of your specialty organizations, and they're active. They'll give you ideas about you know how to get engaged with them, how you can make that change, where to go. They'll talk about the Hill Day, which you guys should come to. It's coming up. And this is a great way to get connected to the advocacy element of our responsibilities. So I think I'll sum it up by saying there's something for everybody here. And I think social media has moved away from being just a network, just a place to sort of post pictures, to something much more evolved with opportunities for anybody with any sort of interests to engage with it. So, any questions so far, Ben?
I don't see any in our queue. If anybody has any questions, feel free to type them into our question box on the right side of your screen. But no, we don't have any right now. I'll let you know if any come in.
Okay, great. I was gonna take a swig of Diet Coke, but we'll move on. So, talking about strengths and weaknesses, I think this is the part where we talk about the application element. So there are a lot of different platforms. So this table here is it's from our earlier publication about, and I want to focus on this for a second, is because moving beyond the well-known social media platforms, you'll notice that there are other ways. So there's blogs, there's organizational blogs. Almost all journals now have blogs. For example, NEJM, Chest. I know ACP has a blog. You can have thematic networking sites. For example, if you're a certain kind of patient or a certain kind of doctor, you can go to connect there. Um, you have actually collaborative initiatives, for example, Figure One, which basically allows you to post pictures in a HIPAA compliant platform of a rash or some physical exam finding and have other experts weigh in, and you can discuss and get better data. You have the obvious media sharing websites, for example, YouTube, but you've you've slide people you've platforms like SlideShare, which basically, so if you're somebody who's doing a lot of presentations and you want to put them out there for people to use, you can use services like SlideShare, basically, which allow you to do exactly that. So I have been delinquent. I think as a fellow, I do a fair share of presentations, and I that's going to be my next area to diversify in, just in case you're interested. This one is interesting. So physician rating websites, they're everywhere, right? If you when you Google your name, once you get off of here, you'll see you'll find yourself on health grades and other rating websites. And the way I think about it is that you can't manage all of them, but just do look into the main ones to engage with. For example, Doximity, because that connects with U.S. News, and so something that is at least well known. And then you have applications that allow you to keep in touch with the most recent data. So browsing or read by QX, these are interesting applications. So they will take your institutional credentials, and then instead of individually signing into journals every single time on your phone, they allow you to, you put in your search word, they put in the relevant data, they put it out for you, and you can just access the article right in your phone immediately without having to put in your credentials again and again. So I think these are very, very effective applications. So all of this together comprises social media. And clearly, nobody can do all of this. So I think my biggest advice is that just look around first and see what interests you. Okay. But talking about the main platforms, I have no idea. I don't know. Ben, is there a way to figure out how many people are on Facebook, or can we turn on everybody's mics for like a voice vote or something?
I mean, not everybody has microphones. I mean, I'd imagine that Facebook is probably the most prominent one that we have. I
Hmm.
don't think there's a way to do a straw poll of everybody right now, though.
Ah, I see. But I assume everybody's on Facebook and Instagram. They are the older and the more prominent networks. But the way different, like you can see here, the way different social media platforms work, they have different strengths. So Facebook, you have no restriction on the number of characteristics you sorry, I thought there was some echo. So there's no restriction on the number of the characters, or on how much you can post or what kind of media you can post, which makes it very helpful, but it can also make it very bulky. I'm sure you all know the endless streams of videos that come at you now on Facebook, so it can be very distracting. Instagram is an interesting, even though Facebook owns it now, it's an interesting model where you can only it's basically very image driven, and it's about hashtag image life. So if you're, say, an educator who's interested in sharing image based learning, that can be your place to go. And then Twitter is it's the space that I work most in. It's mostly professional, there's restriction number of characters that you can write. It's just 280 characters now, though I did prefer the 140 character format. And it allows you to sort of, it's like a blog except very short. So it allows you to sort of interact in that brief and succinct manner. What's also interesting in as far as Twitter is concerned is that you don't have to be friends with anybody. So you follow people or accounts that you like, and if they like what you have to say, they follow you. So there's no expectation to unnecessarily connect, right? Like, so I don't, for example, want to connect with my mom on Twitter because I love what she posts, but it's not helpful for work, right? So, and she doesn't know this yet. She doesn't need to know about Twitter either. But that's the big benefit. I'll talk about Doximity and LinkedIn. So these are sort of professional connection spaces. They're almost like a constant job fair, but you're also able to maintain your professional presence on Doximity and LinkedIn. So Doximity, for example, you can send them your CV and they will upload it to your account and to your profile for you, which I find super helpful because eventually that becomes your online constantly updated presence. What's also interesting, like I said earlier, is that Doximity connects to US News and Health. So it's free publicity. So it doesn't matter whether you're in academics or in private practice. These are great ways to reach out and put your name out there. Um, so this graph, I won't go crazy, but what this graph basically from the Economist is basically, it talks about different platforms, the main platforms, and what characteristics drive them. Interestingly, the blue is positive and the red is negative. So what I want to point out to you is the fear of missing out element, is the element of anxiety with so much going on around you. It seems to be the highest in sort of media driven social media networks. So that's Instagram, Snapchat, and Facebook. So does the effect on sleep, by the way. So yeah, keep that phone down at night and don't go on Facebook, apparently. But I want to point out how apparently Instagram has a very negative effect on body image. I think it's pretty obvious, mainly because it's difficult to explain, but I'm sure you've seen on Instagram how it is a very visually based app and it's about the perfect photograph, right? So the other thing I want to focus on is the access to health advice. So where do patients go if they're looking for answers? And they tend to go mainly to Facebook and Twitter, as you can see here. And then talking about self-expression. So whether as a patient, as a caregiver, or as a physician, if you want to talk about what matters to you and your identity, you tend to go either on Instagram or on Twitter. Um, so keeping all this in mind, this is why I've highlighted Twitter. It's the it's got it's got the most impact on self-expression. It gives you most benefit there, and it doesn't impact your sort of the negative aspects of social media. It doesn't have as much of that. I think Facebook comes a close second. I think it's got both elements but more amplified. So I think it's a reasonable platform also for educators and physicians. So coming to pitfalls and where do you want to be careful with social media? So the simple way of doing this is I would just don't post anything that you wouldn't want anybody else to read, especially people who matter to you, right? Your employer, your lawyer, your mom, your son, your husband, your wife, whoever it is, something it's going to be not in poor taste and it's not going to be acceptable to people who matter to you or who should matter to you. I would strongly advise against it. um, what I really want to stress on is a couple of things here. Most importantly, please keep patient privacy in mind. So for example, this is an anonymized post from Twitter and it talks about trainees exchanging x-rays. I'm not sure if that was compliant or not, but either way, there is it looks like this is an x-ray of a pregnant person. And there was a whole ensuing discussion, and even though there was nothing to directly point at who the patient was, what I want to stress is that it's more than just the name and age and date of birth. So even if you're an anonymous handle, your IP addresses can be easily traced, they can be easily located. Um, People can find out where you work, they connect that with the time and then with a special situation like this, and that's enough to sort of um, cross the boundaries with HIPAA. So I would always err on the side of caution. Um, I would also say that knowing your hospital's digital media policies or your practice's digital media policies is paramount. I know that in the initial sort of last decade, there was a little bit of fear. I think a lot of institutions had policies that were not exactly progressive, but like I was saying, with as training committees, advancement committees are realizing the potential here, these policies are getting more and more inclusive. So just be a little aware of what's okay, what's not okay. I would highly advise to stay professional at all times. Now, I do post a little bit of little hee-haw and personal stuff on my Twitter too, but for the most part, I just stick to what I like to do, which is medical education, research, and collaborations. Um, for example, I have this sort of this whole movement that went out after this physician in Texas talked about his opinions on pay gap. Now, I don't think his opinions were necessarily different from what he put on pen and paper, but as you can read there, they were not even professionally put, and just the whole aspect of the fact that a journal picked it up and the journal put it forward in 2018, it was just scary and very so outrightly sort of just disappointing to read. So please try to stay professional. Remember, you're representing your profession at all times, and just saying on your profile that my views don't represent my employers doesn't really mean anything. It is not a legal disclaimer. It doesn't do anything to protect you. So if you don't want to say something, just don't say it. um, Also, I've seen this happen a number of times. Before we get emotionally charged and excited, it's better to just confirm once more that what you want to post makes sense. So if I feel strongly about an issue, and I do feel strongly about a number of issues, I just take 1 second, a breather, and take a look again, make sure my source is correct, my information is correct, that I'm not just sort of raging and venting, because there's no delete buttons. And this is a common misconception that, hey, I posted something and now it's deleted. The fact is that once you post something in a digital space, it gets cached, it gets screenshotted, it gets tabled, and once it's out there, it's out there. There's no take backs in the digital world. So just being a little cognizant is super important. And lastly, Ben, any questions? I think we're doing good on time.
Yeah, we've got a couple if you want to take a
Yeah, go for
uh,
it.
right. So, as residents or medical students, do we need permission to blog or tweet about a case that occurred during our training/rotations, and if so, from whom?
Okay, that's a very good question. So I think that still comes down to just in general being aware of your hospital's policies, right? Most hospitals would be okay with that. Having said that, being if you're talking about a very specific clinical case, being cognizant of de-identification and staying in line with HIPAA policies is important, right? So for example, if you see a 35-year-old person with Lyme's disease, right, and also has babesia, and you decide to write about it, remember that if you're in Oregon, where you probably don't see so much of this, if you write about this, even if you remove the patient's age and gender, it is easily connectable. So the clinical situation is rare enough in Oregon where if somebody knows which hospital you work at, you could easily be identified. So just being a little careful, anonymizing time, date stamps, um, maybe adding elements or removing elements that can make it specific. So yeah, you can write about it. And also remember that if this is something that interests you, like writing about cases and educational instances, you should check out things like NEJM 360, with and blogs like that, professional blogs that will sort of give you guidance on how to create educational content for blogs without being excessively specific. So there's a lot of those opportunities. If you guys want to write to me, I can direct you towards those
So
opportunities.
to sum up what you said, it's hospital by hospital, case by case basis.
Hmm.
Now, is there a specific title for somebody that they look at their institution that they go to, like a compliance officer or something like that?
Yes, compliance officers usually are the point of contact, but I'm depending on what hospital and everything you're at, most of them will have digital policies now, so I'm sure you can look it up yourself. If you don't know, and you don't want to go to your compliance officer, I get it. That's awkward, right? But you can at least go to your next in command, go to your clerkship director, go to your program director, um, you know, go to your chief resident.
Okay. We've got one more question right now, and then we can go into your introduction to Twitter. This is kind of broader. What would you consider as a measure for social media success?
So that question I will answer very specifically in the second webinar, because that is so important, right? So why are we doing all this? What's the whole point? What am I going to gain out of this? Like I was saying, use of social media for advancement in careers has become, it's a thing now. It's being formalized slowly. So there are metrics for gauging your social media activity, right? So for example, it depends on what you do. So for example, if you make videos, you have, how many people are interacting with your videos. Are they leaving comments? If you're writing blogs, you can look at things like alternative metrics that number of different organizations give out, like altmetrics.com, for example, and that gives out the reach of your article. And so, yeah, this is important. If you do anything on social media with the idea of furthering education or your professional sort of reach, you need to be aware of a few things. Where is the content being cached? Are you going to be able to reproduce it? Is it being monitored for peer review? And then what are the metrics? And all of this I will talk about next in the next webinar specifically.
Okay, so that's what we have for now. So if
Okay.
anyone wants to ask more questions, feel free to use the question box on the right side of the screen. Otherwise, we'll move on.
Okay, great. So coming to Twitter, and I think, like I said, besides the fact that I am slightly biased to Twitter because that's where I have put in most of my energies, I will, in full disclosure, say that it doesn't have to be Twitter. It can be anything that works for you. So if you're a person who's into, suppose you're a sketcher, right? And you want to educate people by sketching scientific concepts, or you want to sketch out, I don't know, practice operation graphs, that's fine. You can go with, say, Instagram, which is more visually directed. If you are more of a webcast person, you're somebody who likes to have conversations, you can do live Facebook videos, create a group for your venture and do live Facebook videos. So I think you have to figure out what you would like, what platform can answer your interests. And so having said that, professionally speaking, for physicians, Twitter is the most heavily sort of used platform, simply because it's limited in terms of how much you can write. It is very precise. You can connect with people right from secretary of the VA to your surgeon general. They're all on Twitter. You have, and they'll, like, I have had an opportunity to interact with so many people who I would have never been able to talk to. So that's the reason I picked Twitter. Um, so I'll go through that. Again, if anybody wants to talk about other platforms, please just email me, and I'm happy to go over that as well. So this is your typical screen on Twitter. The reason I put two of these is because like I keep saying all the time, stay professional. So this was me being professional. I have a headshot that's recognizable. Because I do love the Plura so much, I had, you know, images that sort of fit my interest. But you can see this was after a recent conference, and I just changed it a little bit, and it's okay to have a little bit of fun. It's still professional. So when I say professional, it doesn't have to be boring. It can be fun. So that's why I put two of these. But this is on Twitter. You have a head bar here, which basically, which basically has your home screen. So you click home. You have notifications. So if people are interacting with you, it'll all be under here. And then people who are messaging you directly, these settings can be changed. You can choose not to be messaged by anybody, or you can be messaged only by people who are interacting with you. This bar here shows the amount of tweets since you started, people who you are following and people who are following you. Uh, Twitter is always smart about giving you recommendations about who to follow, and I find them very, very helpful. Um, and remember, if you don't like who you're following because the content doesn't jam with what you're interested in, you can always unfollow, and I don't think anybody takes it the wrong way. This here is your timeline. So these are people I follow. So Sumit and the Yale account for pulmonary critical care, these are people I follow and what they're saying. I'm not exactly sure why Sumit was talking about Sartorius, but what was interesting is that David, the person who made the initial post that Sumit shared with his comment, but had a lot of interesting facts in that tweet. So, like I said, with time, I've been able to modulate my timeline in a manner that almost everything on my timeline is very specific to what I'm interested in, which is PulmCrit, medical education, simulation, social media-based research. So, how to get on Twitter, and this is not in the effort of trying to be overtly simplistic, but seriously, it is very, very simple. You go to twitter.com and you hit sign up. It's the simplest form. Once you get on there, you just have to put in you make a password, and you don't even have to put a lot of information in, and that's it. You're all set, and that's how you get started. And this is not me being sarcastic or anything, but sometimes just realizing that there isn't anything to it is it just makes the job easier. So once you do, use your account, you created it. I'll go over the details of the screen. So like I said, the control bar has all these options for you to interact with. Um, you do have quick links to your own profile here. So if I click on the picture, I can change that. You can always change your name. And this is what is called as a handle, this @Viren Cole. All it is that it allows people to find you and interact with you. That's all the handle means. Um, you can also click on each of these things here, following, followers, and tweets, and it'll give you more details about those specific topics. Whenever you're ready to sort of start interacting, what you do is that you hit this button, tweet, and you write what you have to, and it's as simple as that, and it just goes out into the void. People who are following you, it pops up on their timeline, and they start interacting with it. Okay. What I find interesting is also trends for you. This section here, it gives the topics that are being talked about in the digital sphere that would be of interest to you. I have no idea why I thought either of those would be interesting trends for me, but yep, insecure HPO apparently. Um, Talking about the last part is the anatomy of a tweet. So what is in a tweet, right? So this is a tweet. A tweet means a post. It's like Facebook writing a post, right? So this is a tweet I did, and on the top is who's the person who's writing the tweet. This here is the body, right? So this is what I had to say, that hey, this is a difficult pathology. I post a picture to go with it. So what a couple things you'll notice is that this here is something called as a hashtag, and all a hashtag is it allows you to curate content. So for example, if somebody was to hit this hashtag up here, Fantastic Friday, posts across the whole platform, across all of Twitter that have this in the post would show up. So in a lot of ways, it's a good way to collect things at one place. So for example, um, when we did when NYACP had its conference this year, we made the hashtag NYACP 2018. So whoever used that hashtag while posting from the conference, all that content's under that hashtag. So when Ben and I wanted to go and look at how people's experience was at the conference and what they did and what they liked, what they didn't like, all we had to go is hit that hashtag, and we were able to get all that information. So you can similarly engage in sort of, that's what you use hashtags for. Lastly, the bottom line here, it gives you an idea about how people are interacting with your posts. So you see these three bars here. If you hit them, you'll be able to see how many impressions your post has made, how many people have responded to it, what is the percentage of interaction. So for example, if the post was seen by 6,000 people and only 5 left comments, so what is the percent interaction there? It helps you with time as you start interacting on Twitter. You'll realize what makes an interesting post. And I just don't want to overburden you today, but basically using pictures, basically using videos, giving educational, helpful, post content, using hashtags, and then tagging other people are some of the ways in which you can have high engagement value of your tweets. So, Dr. Gutierrez is one of the physicians again that I've met on Twitter, and she's a fantastic, fantastic physician. But I just thought, besides her amazing announcement here, I should go over what terminologies mean. So again, like I said, that at MV Gutierrez MD or at Viren Call is just a way of finding us. So just like she has tagged the McGovern Medical Center here, that's just her way of sort of giving them a shout out, and they get this notification and they can interact with the street also. Um, this is called as a, so this becomes what is called as a mention, that you're mentioning another handle, and eventually the handle will get all the notifications and all the interactions, which again, if that's not what you want, you can always recuse yourself from further interaction. So don't worry, you'll never be over flooded. And lastly, like I said, hashtags. So Dr. Gutierrez, um, she talks a lot about women in medicine, about our underrepresented minorities in medicine, and she used this hashtag to sort of push this tweet out in that space. And once you go to that hashtag, you can see other very inspiring content from that area in medicine. So I would say basically, to sum it up, just start slow, pick a platform that you think is interesting to you. And if you don't like it, you can always move on, but give it some time. Um, Nobody's going anywhere. So if you don't get immediately 7,000 followers, that's okay. I was initially on Twitter from 2009 and didn't do anything with it because it didn't make any sense to me. And then in 2017, I suddenly just started seeing all this awesome content and basically rapidly build my way around. So just feel your way around and you'll figure out what your niche is, where you want to be. And if you have any questions, you can email me. This is my email. You can always find me on Twitter, and I'm happy to collaborate with you on any of these various opportunities in social media. So thanks for listening. We have a few minutes. Any questions,
So,
Ben?
if you have any more questions, we do have 1 or 2 minutes left. We do have a few coming in, but if you have any, feel free to type them in on the right side of the screen. Excuse me. So, should we be open to answering patient questions on and any social media messaging platform?
I think that's a difficult one because, so first of all, if somebody asks you what I should do for my headache, I think that's a strict no. I think maintaining boundaries is so important on social media. However, for example, you're having discussion about, say, pulmonary fibrosis, right? And patients and patient advocates and patient caregivers are on there, and you're talking about the disease in general. And say they ask you, oh, does old age affect progression of IPF? That question is okay to answer because you're having a general discussion. But targeted, personalized, personal health-related questions is an absolute. I mean, I would draw a line there.
So if they're seeking medical advice, they should go to a doctor, as opposed to the one on Twitter.
Not the one on Twitter, yes.
Okay.
Like a real
So I'll
person.
have the last question, and then we'll sign off. And if anybody has any more questions, as Dr. Call showed you, he's got an email, and I'm sure he'll answer some. And he's always available on Twitter. So
Yes.
with so many options to either tweet or post to Facebook or use LinkedIn, are there any platforms that are strictly focused on medical or healthcare topics? And were they shown in any of the earlier slides?
Yes. So let's see. So the answer is yes. The answer is absolutely yes. If you just want to do medicine, then let's see.
I think Doximity is one that people like to refer to quite often.
I'm just trying to. I think I just went past the slide, but I'm just trying to find the slide, which it would be. Hey, there you go. So if you look at this here, you'll see that there's professional networking sites, right? So in there's Doximity, which is purely just basic, and Doximity is actually just US based medicine too. It's not even people from other countries don't get involved either. But then you have other things like Wiki Surgery, Wiki EM. You have sites like Life in the Fast Lane. You have Rebel EM. Who those are not only just blogs. So for example, these are not just blogs that I showed you in the beginning. They are also a good way of sort of interacting with other members. Like you can actually just talk to people, that these are not just like people writing at you. So all of these, so for example, NEJM is something that I find very, very helpful. So NEJM 360 has a blog and a discussion space built purely for trainees. And they hold discussions about all aspects of training, practice operations, foreign medical graduates, residents, fellows, specialties, and there's just doctors and medical practitioners. So yeah, check out any Gem 360 or any of these places. Yeah.
Okay, great. So that looks like that's it for our questions. Would you have any parting thoughts for us before we sign off for the day?
Yeah. The parting thought is get on it. Don't be scared of it. The whole social media space, and always reach out. There's somebody to help you. I'm ready to help anybody who's interested. So please reach out to us.
Thank you, Dr. Call, and thank you everybody for attending this webinar. This is the first part in a two-part series. The next one will be in January, so keep your eyes out for that.
Thanks, Ben. Take care, everybody. Bye now.